The July 20th meeting of the Nantucket Board of Health is now in session. Just to remind you all that the meeting is being recorded, both audio and visually. Are there any public comments on any issue that you have that is not on the agenda for today? Mr. Barnes.
Good afternoon, Curtis Barnes, and I have a couple of questions about the short-term rental program, unless that will be addressed by the director in his report.
Go ahead. I am going to talk about it in the report, but I would say go ahead.
And go ahead.
I just want to be sure after last night's meeting that the portal is not up. I can't register, correct? Nobody can register yet.
Correct. No one can register
Okay,
yet.
fine. I was concerned in the director's report to hear that Granicus had not been performing up to the standard that you were expecting. And I believe the director said it was going to be moved to a higher level. It is disappointing that we're paying Granicus all the money that we are to replicate state records and to establish an emergency phone number, which will be the police, not their number, and that they're not performing. I seriously raised the question whether you should continue the contract with them. You had to go to another source for data, and I don't think they're performing very well. Thank you.
It's in the report, so I'll go ahead and give it now. Say that now, but we're actually not paying Granicus anymore based on this last contract until this all gets done, taken care of. Based on this, we haven't executed any new contract with them yet. We want to see how this goes first. This needs to be closed out first. So Granicus is no longer receiving any payments from us until the short-term portal opens up.
Yes, and that was the consensus of the select board as well, but not to pay them at this time. Any other comments from the public? All right, well, let's get on with the agenda. If it's okay with the board, we'll defer the minutes to the next minute because we don't have any minutes to
We didn't
approve.
put them in. We missed them in the packet this month.
So we'll do that in August. Fisher's Landing betterment release.
Yep, this is a standard betterment loan that we had already issued. Everything is taken care of. All the fundings have been released. So we need a vote from the board to release the betterment loan.
Any questions from the board?
No objections.
I have a motion.
Motion to release the lien.
To release the betterment. Yeah.
Yeah.
Second the motion. Any further discussion?
I second it.
Okay. Any further discussion? All in favor, aye.
Aye.
Chairman votes aye. We have two condemnations, 21 Sheep Pond Road.
Yes, so 21 Sheep Pond Road had its some structural damage due to erosion. It is no longer in a livable condition. It has to be moved back from the bluff. So we condemned it as from an emergency perspective. We just need the board to ratify it with a vote.
Any questions from the board?
Are they, people, are they
Can you, excuse me,
getting rid of everything?
closer to your microphone?
Your microphone.
Oh, I'm sorry. Are the owners doing what's supposed to do, taking the deck out, taking the trash out, getting rid of it?
So I know they've been in contact with Natural Resources. I don't think they've been in contact with us yet. Kathy, do you mind?
Kathy LaFave, Health Inspector. So the house is actually about 95% empty. There's nothing in the garage. There's only a refrigerator, I believe a washing machine and a dryer. So they're basically in contact with Toscana, who's supposed to remove the deck. And then the house and the septic and the well are going to be dealt with. But the house is virtually empty at this point. I imagine they're going to have to get a permit through Concom as well.
Correct.
Okay.
Okay, thank you.
Any other questions? Do I have a motion to approve the condemnation?
I'll make that motion.
I'll second that motion. Any further discussion? All in favor, say aye.
Aye.
Aye. Chairman says aye. And another one, 8 Macy Lane, 8 Macy Road.
Yes, very different situation. This road, this home is severely damaged due to issues with the previous tenant. It is no longer in a livable condition, so we did request that it gets rehabbed. And we are condemning it because there is no running hot water. There's some structural issues, things like that. So until it gets rehabbed fully, we are asking for a ratification of the condemnation.
Any questions from the board? In a motion,
I'll make that.
a motion has been made for
Second,
confirming the condemnation of 8 Macy Road. Any further discussion?
She made this one.
I heard it, yeah. All in favor?
Aye.
Aye,
Aye.
chairman says aye. Millie's mobile food unit variance.
Correct. So
You want to explain this to us?
yes, so we did set up a policy almost 8 years ago now, where the mobile food units would have to meet a specific set of standards. The standards are in the packet before they're allowed to request a variance to stay at one location for more than 1 day without having to return to base. In this case, I know it says at 1 Sparks Avenue, but it is actually for the mobile food unit that's actually at Cisco Brewers. We are requesting that they return to base every day, but they are requesting the variance to be able to only return back once a week. And I think for the applicant.
Yes,
I
is
did
the applicant
see Done.
A representative here?
Good afternoon, Donald Dariush for Millie's. Well, Millie's is hoping to leave our mobile food unit at Cisco Brewery, mobile food unit number 1. We have 3 of these units. We've been operating there every day past really almost 10 years, bringing it back and forth with a truck and a trailer. Our previous unit there was a physical truck that could be driven and registered. This unit is now a trailer that is pulled behind a refrigerated Dodge Ram. We've been bringing it to and from Sparks Avenue, which is where our mobile food units are based all season. And it's rather cumbersome. We're hoping to apply for a variance to leave our unit at Cisco Brewery with all the meeting the criteria that was established in the 2016 Board of Health meeting. The same variance that Lobster Trap uses to allow their trailer to stay there and return back to base once a week. Not only is it really a safety thing with driving a 20-foot trailer with a 20-foot truck through Nantucket, through the Rotary area at peak traffic times early in the morning, around 6 o'clock at night, and maneuvering through the brewery's parking lot, things like that. We've had an exemplary record with that trailer at the brewery for the past. That trailer was introduced in 2016, but we've been there for 10 years. So it's been a solid record since, and we're hoping to build upon that by leaving it there and bringing it back on Monday nights for a deep cleaning procedure. I've also brought with me our sanitation records for the past season that have been, weekly check essentially of what we've been going through, which I'd be happy to share with anybody who's interested. And we'd be continuing to adhere to that if we were to leave it there daily and return it back on Mondays.
Thank you. Comments from the staff? Difference of this of Lobster Trap, for example?
Hi, Kathy Flynn, Health Inspector. We're just concerned about precedent, first and foremost. There are right now we have 21 mobile food units, and with 2 pending, we have 8 trucks, 8 trailers, 2 carts, and 3 other, there's like Noemi's Dumplings has a freezer that had this put on a cart, that kind of a thing. So those are also permitted as mobile food units, but we're just afraid of a precedent setting situation.
So I'm hearing precedent and I'm hearing conveniences. I'm looking for health issues here.
There was mentioned about the sanitary tank there, setting a precedent and keeping the tank sanitary. So we get more on that.
Yes, well, if you look at the staff report that I sent, I attached 4 meetings that was discussed back then. They were really worried about precedent and keeping it sanitary as well. But I only can't speak too much on the sanitary portion of it, but we're more concerned about precedent.
So yeah, John Hedden, Chief Environmental Health Officer for Town of Nantucket. So per the food code, mobile food establishments or mobile food units are supposed to return to their base of operations every day for such things as emptying out their gray water, cleaning, boarding food, water, all those types of things. As Kathy said, I think this sets a bad precedent. I personally need more information from what I saw was submitted. I don't know if this plastic tank's just going to be sitting on the ground. It's not very sanitary just to have a tank of water sitting on the ground outside the vehicle. I think this is a bit unfair to the previous, the Lobster Trap, who had gone through this variance and is the only one that holds it now. When they've gone through everything, they have a larger vehicle that was able to encase the larger tank on the unit itself. So, you know, having this exterior gray water tank, I would think would enable every single mobile food unit to do the same thing. And that's not what we're after. We really want all these units to be returning to base, cleaning every single night, you know, emptying their gray water and everything. So.
All right, so the difference is a gray water tank on the ground or in the unit, as in the case with the Lobster Trap?
So to answer that question, yes, the lobster trap unit is completely self-contained.
Right.
The wastewater tank is on board and is movable with the trailer itself. This wastewater tank is not on board and gets moved independently.
Right, in a potential environmentally sensitive area.
Correct.
I just want to make sure, because we've heard a lot of words about precedent, but we have a precedent of the Lobster Trap. So it has to be clear that there's a significant difference between what the Lobster Trap is doing and what Millie's is requesting. Are there any questions from the board to anyone?
Are the tanks the same size?
We do require the 55-gallon tank.
So is Millie's tank 55 gallons?
The tank that we propose to have would be a 55-gallon tank on top of a 10-gallon tank that's already on board. So it would be a total of 65 gallons, 10 on board, 55 gallons off board. And we'd be happy to work with staff or the board on any type of procedure they would like to see in moving that tank or in sanitizing it, things like that. We would be following standard, like let's think like RV tank sanitizing procedures to clean out gray water, following that. So what we've been following with our existing onboard tank and what most mobile food units, I believe, do. But we'd be happy to work with the staff on establishing a procedure for that and solidifying it, adding it to our checklist here.
I have a question.
Go right ahead.
For Millie. You know, besides convenience, is there really any other thing? Because if you've been doing it for 10 years, it has been working. You know, it'd be smoother if you could leave it, but it has been working, is my.
Sure.
And is there any other issue besides convenience that is being addressed?
I think that the traffic factor of not having to negotiate leaving Cisco Brewery at odd hours of the day or having to park a truck and trailer at a main artery on Nantucket at 1 Sparks Avenue would be an alleviance to all that experience that rather congested artery of Nantucket.
Thank you.
Safety factors, anytime a truck and trailer goes on the road, I feel like there's a degree of risk, whether it be a landscaping trailer, a food trailer, or a boat trailer. So limiting that was beneficial in my opinion.
Last year it tipped over.
Right, correct, yeah. A very fair point.
John, what are we looking at for all the other people that are abiding by the rules right now? If we granted variance for this, are we looking at other people coming in?
I'm sure you
looking for
would.
the same thing?
I'm sure you would be. Yeah, absolutely. You know, as it's, Kerry was kind of alluding to, I think it's really more
And
of
how
a
many
convenience factor.
people will be talking about that?
As Kathy pointed out, maybe, as much as 23. We have,
Excuse me, to be
close
clear,
23 mobile food units.
Through you, Mr. Chair, 20 one right now when we have two pending. And I also think there is Cisco Brewery too, which is in the harbor, in the Hummock Pond watershed area. So that's also a concern.
Right.
So yes, there's 21 operators at Cisco Brewery, but only 3 are daily. That's Millie's, the Lobster Trap, and Lemon Press, I believe. Everyone else there is either 1 day a week, 2 days a week. There's the Raw Bar, there is the pizza place. They come and go because they're not every day. Only so if you're looking at it in a vacuum, if you look at it specifically in that the 2 or 3 places that operate every day, you're limiting your number of variances that potentially come in. Also, I would argue that the variance is existing for this very reason. We've established the variance in 2016 by this very board for those to apply for it.
Mr. Chair, if I could add one more thing. We inspect a lobster trap trailer once a week. That was part of the for cleanliness, and they kept a log. So potentially we could be looking at 20 inspections a week, which I think is onerous for the staff to check the cleanliness of 20 mobile food units a week.
Well,
Go ahead.
I'm still looking at the problem that if we grant this variance, we might be looking at 20 more people coming in here to do the same thing.
That's a possibility, yeah.
That would be subject to approval by Cisco Brewery. Cisco Brewery only allows a certain number of vendors to be there every day. So not only would it require, there's no point in a vendor leaving a trailer there overnight if they're not operating the next day. So the only people that would potentially apply this year for this variance would be ourselves, Lobster Trap, which already has it, and Lemon Press, who's there every day. So
Or other food trucks around the island, right? I mean, this is not something that's going to affect just Cisco Breweries. This is all the other food trucks on the island. Sorry, like I understand that it's those 3 that are there, but there's obviously a lot more that are not there. I'm sure if they're operating at Cisco 1 day a week, they're somewhere else the other 6 days.
Okay. Any other comments? Any suggestions? Anyone else want to comment on this issue? Hearing none, I need a motion to approve or not approve the variance.
If I make a motion is to deny,
Okay. We have a motion to deny the variance. Do I hear a second?
Second.
Do I hear a second? Any further discussion? The motion is to deny the variance. All in favor?
I
And it carries unanimously. Variance is denied. Private well regulations.
So this is a public hearing, so we do need to vote.
It is a public hearing, yes. I now officially open the public hearing.
So over the course of, since December of 2022, we realized that there were a couple loopholes in our old well regulation. And then just in general, the well regulation was obsolete. It was almost at this point, it's almost 30 years old. Well regulations and the science behind it has changed significantly, including how we have now mapped out our aquifer and our watershed districts. So we felt that a update of chapter 386, our well regulation needed to be done. Luckily, perhaps serendipitously, the State Department of Environmental Protection came out with a model local well regulation for private drinking water wells, which included things like our PFAS, the current PFAS regulations, as well as protection of nitrogen sensitive areas. So what we did, we worked with Michael Maynard, who was not able to be here today. He didn't make the boat. He got stuck in traffic today. So unfortunately, he's not here. But Michael, John, and I worked on a new regulation, which is what you saw that I emailed out. And I believe it's also on the proposed regulations section of the town website. We did also send it out to some engineers and surveyors. We did get a few comments from Mr. Blackwell, who is here as well. Some of those comments are very valid. And we just want to open the public hearing to start taking discussion. It doesn't have to be voted in today. We're happy to change any of it, add, remove, do anything to this work. There is a policy brief in the packet that was written by our intern, Marianne Vasquez Cruz. From
Nice job, by
UMass.
the way.
Yeah, it was a tremendous work by our interns. So we're very happy with them today. And then really we're just here to open the hearing and start taking testimony.
Right, so I think we can listen to comments. You know, if we have a lot of comments and a lot of people are concerned, we can put up a vote, or we can vote today, depending on what the sense of the public is. So the public hearing's open. Do we have comments from the public?
I would recommend that we hear from Mr. Blackwell. He had some very good comments,
Yeah,
Nantucket specific.
I see him standing
Comments.
up.
Thank you. I'm Jeff Blackwell. I'm a land surveyor here in Nantucket that has been working here since 1980, and part of my practice has been on permitting many septic systems and well permits. So I read the state model regulation with interest and kind of went back and forth comparing the current regulations here with the draft model to date. I think it's a good start, but there's a fair amount of work that remains to fine tune some of its housekeeping, maybe the identification of situations that no model regulation can envision every scenario that may come up in a setting like this. I think there's also some portions of the current regulations that have been omitted from the draft that need to be considered and addressed by the Board of Health. Just as a very short history of the Nantucket well regulations, prior to 1990, the permitting of wells on Nantucket was very basic, and the standards were basically an adoption of the Title V code for the placement of wells with 100-foot setbacks to sources of contamination like leach fields, septic leach fields, and so forth. And the Nantucket Land Council commissioned a study by an environmental firm on the Cape, Horsley, Witten, and Hegeman, who did a groundwater study for Nantucket, applying general hydrogeologic principles, and then fashioning their report for Nantucket. And they basically drafted their own model regulation for well permitting and protection on Nantucket. The Board of Health in 1990 more or less adopted the Horsley, Witten, Hegeman Land Council recommended regulation, and that has been in effect pretty much without any change since 1990. One of the major things that regulation did was to take into consideration the direction of groundwater flow and to enhance well separations to contaminating sources that were up gradient from proposed wells. And but they also, the regulation in 1990 also recognized that there was most of the lots on Nantucket still were created before 1990, and the opportunity to render lots unbuildable or highly restricted in other ways was recognized by the Board of Health in 1990, and there was an entire section of entitled pre-existing lots and relief that was described for those sorts of lots. And, one concern I have is there is no recognition of those pre-1990 lots in the draft regulation. I don't want to go into there's a lot of improvement, I think, and just fine tuning that the draft could benefit from. And I think the board, so as not to get bogged down in the minutia, might consider recommending volunteers, and I'd be happy to volunteer to work with the health department to work through a lot of these. Some of it's just housekeeping and some of it's more than housekeeping, so that when you have your next hearing, you have a draft regulation that's fleshed out, more substantial, and I hope would take into account a lot of the real world practical situations that I've run into and many of my colleagues in surveying and engineering have run into. So I'm your first volunteer if you are looking for that sort of input. And that's all I have. Thank you.
Any questions for Jeff or?
Jeff, quick question. So we've had several where about the unbuildable lots, and that's come up, and that pretty much is what's stimulated this whole, desire to change. Are unbuildable lots bad?
If you owned them, they would be.
Yeah, but it's a community. It's not a serious, my water impacts the next door person, and, there is an attempt to try to mitigate, I think you'll mitigate those kind of negative influences from my property on someone else. And, if a property is unbuildable, is that it's negative for the owner, but the regulations existed for a reason to maintain health and safety of the water supply. And we only have one water supply, so we're kind of.
Well, I think we need to differentiate between private lot owners who are applying for a well permit and the general aquifer for the town of Nantucket. The installation of wells is not a contaminating source for the general aquifer. So I think you have to, the focus has to remain on people that are applying for wells to serve either currently developed lots where a well may need to be moved and to accommodate a new septic system, a modern septic system in the case of failures. But it's, I think the two matters are clearly separate.
Yeah, underground injection from an irrigation or a drinking water well is rare.
Yeah. But again, I guess because it is an unbuildable lot, something
Correct.
that is a negative, to the outside of the individual owner is an unbuildable lot, a negative thing.
That's a philosophical subject that is not, I can't help you with that.
Okay.
That's
okay.
what's good for
Just
the
wanna throw-
island.
Just want to throw it out there.
I'm not very good. I'm not very good at philosophy.
Thank you, Dan.
Thank you.
Thank you. Anyone else?
Stephen Cohen, I think there might be a little confusion there because if I understand correctly, we're talking about lots that are currently buildable that might become unbuildable, but we're also talking about lots that are currently developed that might become severely inhibited, in fact, in ways that would be better for public health and safety by the moving of the well or the upgrade of the septic system. And I think what Jeff's suggestion is that the tools that currently exist that enable the Board of Health to make those approvals should remain in place. So I don't think we're talking about whether or not lots should be buildable or unbuildable, whether or not this board should retain the tools to make good decisions. Is that fair enough? Thank you.
Thank you.
I think we found our second volunteer.
We have a second volunteer. Yeah. Any other comments?
So in discussions with Mr. Maynard, and I know John is coming up too, with these comments that Mr. Blackwell sent in this week, I've been going back and forth with Michael, and there are some very good comments, and
Good.
I'll let John go before we continue.
Yeah, so I'll agree with Roberto on that. I just received these comments the other day. So I need a little more time to digest them from Mr. Blackwell, but I think he does make some good points. So I'd be willing to sit down with him for, a little bit, an hour here, an hour there, just to gain a little more input from him. And back to the vacant lot thing on the lots prior to 1990. My problem, which came up in the past, was when people were doing new construction on neighboring lots and installing soil absorption systems, which were not respecting the 300-foot protection well zone that we have locally. This regulation is for wells. So if the lot was prior to 1990, I still believe they should be able to install a well within that 300-foot radius, but they'd still need to meet the 100-foot from Title V. So.
Thank you. Good points. Anyone else? Other comments from the board?
I just have some comments about the PFAS, just that I know that the 6 are the 6 that are currently identified, but there's actually many more. And I think that there should be something maybe in this that allows for the 6 and
Whatever's coming.
Yeah, because as someone that has had PFAS in their water and not been able to drink my water for too long, this is pretty scary. And the 20 parts per trillion that it was, and now it's basically no level is safe, I think they're saying. I mean, we're saying 20 here, but I know a 0 level or whatever is the lowest measurable is really what is safe. And if we're looking at the public safety and public health of our island, and we have one aquifer, even these wells are all pulling from the same place that our town water is coming from, probably just at different levels. So I really think like a 0 PFAS or 1. I mean, no level is safe. So why are we going to say 20 when we know the newest update is 20 is not safe? Sorry, this is my soapbox. And when you can't drink your water in your house, it is horrible. When you don't even know if you can bathe your child in your house. And I don't think we really should do something to make it a 0.
The 20 is the maximum contaminant level that the state allows. It's the state set. We are allowed to go stricter than the state.
We can go stricter.
And the only thing we can't do is add the chemicals that aren't identified in their regulations yet. However, what we can do is, and Brian, let me know if I'm wrong. Town council's on the call. Let me know if I'm wrong. What we can do is add wording into this regulation that would automatically adopt the new state standards for PFAS as they show up. So if they go from the PFAS 6 to PFAS 24 or to PFAS 2400, it would automatically adopt. Brian, correct me if I'm wrong. Can we do a living document like that?
Yes, I would say that would be a valid, a valid regulation.
Perfect. So
That's a good suggestion.
It's a great suggestion from Meredith here. And we're more than happy to. There is no safe contaminant level of PFAS. We know that. It's a man-made chemical, and we're dealing with it the best we can. There's more PFAS destruction technologies that are starting to come out. And I think the better we can get at destroying it, and if we can plan for it, I'm all for it. I think the regulation as it stands right now is a very good start. I think we're, and Jeff, correct me if I'm wrong, we're probably like 90% of the way there, we still have some things to fix on. So what we wanted to do, it's just we can't discuss it with the board unless we're in open session like this.
I think
So
we're hearing a couple good anything else, and then we can move on. I mean, if we have Jeff as our volunteer and you're willing to sit with him.
we can continue it probably.
Yeah, we'll just continue we won't close the session.
Yeah, and we can probably just continue the hearing to. Let's just to give us some time. Why don't we do the September meeting?
Yeah, I was gonna say August is.
So that would be September 21st.
We'll do it.
And when we will work on the regulation, adding Mr. Blackwell's comments, I'll get it to the board, adding Meredith's comments here, and we'll get it to the board with all the new comments, all the new draft, and then we can bring it back.
And if there's any other volunteers,
Yes.
we have your number.
Yeah, and can I just make one quick comment? Yeah, because again, when we had the variant discussions, it always had to do with a lot had to do with the language between Title V and well regulations. And that was, a lot of discussion was, can we make it so that there's kind of conformity of language between those so that we kind of stop these circular discussions about
Yes.
what are we really talking about?
The
And I know from the past meetings, we had several good suggestions about that from, meetings probably like 6 or 7 months ago when we were dealing with some of the variances,
correct with the new Title V that was just voted in.
the state one.
The state, with the new Title V that was just voted in, and this model regulations, they were designed to work in congruence with each other. That's why they did the two at the same time. They found it was a great opportunity as they found it. So the model reg and the current Title V do work together. There are Nantucket specific things that make it a little bit more difficult. So for example, we used to call them spite wells, where because you had 300-foot exclusion zone upstream, we would see drinking water wells that are not that were being installed on a house with just on a lot with just a foundation, just to block 300 feet of construction ahead of them. So they would pull an active building permit, do minimal work, even though there was never any intention to occupy that home. We have seen those stop. We haven't seen spite wells in a long time, but my first year here, there were a few. About 8 years
We
ago.
can address, again, we have unique conditions here, and if we can, through regulation, address as many of those as possible, so we leave the amount of variance discussion to the ones that really are truly unique, that we kind of just keep getting in this battle that is, it's not that silly, it's just that we're not changing anything, and there were some basic problems with the regulation that are being addressed. If we can tighten up that 10% now, so that we really have a minimal number of variance requirement discussions, and keep our water safe, that would be great.
Sounds good.
So I've got some good suggestions. So I guess I need a motion to continue the hearing until September
21st.
Motion to continue it until September.
Second.
Second. All in favor?
Aye.
Aye. We will continue this discussion in September, and we have and anybody can walk down to the health department, give their input. I have a very informal working group.
Yes.
All right, summer house appeal. I've been informed by the health director that some progress has been made in coming to some agreement with the summer house.
Significant progress. We do need to reopen the hearing because it was continued to today, and I'll be more than happy to give the full update.
Well, then what we will do is I will reopen the hearing and continue it from last week. And then we'll ask Roberto and then the representative of Summer House. And hopefully we have some resolutions.
Yes.
Which will make everyone very happy.
Yes, I believe so. And Ms. Manning, correct me if I'm wrong on any of this. We did have We did have a meeting with Xavier Severa, who is the food consultant for the summer house on Monday at 10 a.m., where we went through all of the processes that we had laid out, all the discussions, what we were looking for as a department, when that letter came out in June, and worked through what we could. That day or the day after, Mr. Severa dropped off the plan review for the restaurant with all the updates that we were looking for, just with all the information. And then the recommendation that we were going to make to the board was going to be that we request a food consultant to be retained by the summer house to provide in-house in-house trainings with self-inspections, proof of food handler training for the staff, be in communication with us monthly so that we can keep an eye on that. And then before opening for next year, to have a discussion about the operation manuals for that lays out details on operations and procedures. And then with that, we had no objection to the discussion. And then I believe the agreement was dropped off at our office this morning. And it's I re-uploaded it to the packet so that you can see it. And I think we can move forward with a.
So that agreement is a written agreement, and we have.
Correct, and it's in the packet.
It's in the packet?
Yes, it was updated just about 2 hours ago.
No.
So sorry. But yes, we did
Is there
receive
some
it.
way we
and,
could get a copy of that here?
That's an agreement regarding the retention of a food
Yes.
expert to
Okay.
assist with the training. It's not in the sense of an agreement between us and the town. I just want to
Correct.
make that
Okay,
distinction.
that I see.
Okay.
Correct. Yes.
Okay,
Mary Ellen Manning on
Welcome.
behalf of the Summer House. Nice to see you all again. Good afternoon, Attorney Riley.
Good afternoon.
Okay, so just to add to that, I think the director gave us a considerable amount of time, and all of the departments were involved in making sure that we got back online. And they all gave us a considerable amount of time. The Summer House Restaurant is, of course, a distinct entity from the Summer House Bistro. They're both separately owned, and they're both separately licensed. The Summer House Restaurant had fewer issues and was easier to get back online. So that has passed all of the department's inspections, including, correct me if I'm wrong, Mr. Santa Maria, the Board of Health, with the provisions, yes, with the proviso that we enter into provide a site plan, which we did, and develop a training program going forward, which we have. So the Summer House Restaurant, as far as we understand it, there's no need to go forward with a hearing because there will not be a non-renewal of the Summer House Restaurant at this time. And we can go forward with the issuance of the Board of Health license and reopen. With respect to the Summer House Bistro, which is the building that is closer to the water as you go down the stairs heading towards the beach, that continues to have some physical changes that need to be made. It does have a plan review for the bar area, where there were some changes made to that. There was some electrical and plumbing that's being done, and everything is proceeding in due course. All the departments have been involved. The gas has been delivered, and it appears as though the issues regarding the plumbing have long been corrected at both locations, but there were some additional issues that we're working on to improve the physical structure down at the bistro. Given the situation that we're in and that we're in contact like this, our agreement regarding food training going forward is something that we intend to also do with the same employees and the same contractor down at the contract applies to both places. And so it's our hope that going forward, we would be able to move forward in due course and that the bistro licenses the bistro food permits would also be allowed soon pending a Board of Health inspection. If we succeed with the Board of Health inspection, all of the other, that comes last, so all of the other departments will have already inspected and approved. And at that point, the licenses for the bistro would issue, given the same conditions that we've already gone over. And that would probably be soon, but not immediately, as opposed to the restaurant, which would be forthwith. And thanks for it's long-winded, but I think I hit all the high points. Thank you.
We have no objection.
You have no objection, so
Yep.
so as soon as you have
As that,
this teacher or.
yep, and the contract the contract that's in the packet is actually the agreement with this food consultant. They have met the requests of the board, or of the staff, and we have no objections moving forward. All that's left is the go-ahead from the fire department, and I believe that's already scheduled, I believe.
Fire department upstairs, you mean? That's been accomplished.
Okay.
Fire department
Right,
downstairs
is passing.
might be.
As far as the health
Okay.
issues, you are satisfied.
Yes, we will continue to monitor as we normally do, as we always do. We'll be doing our normal monthly inspections, but we will move forward as we
Right.
do with every other restaurant on island.
Questions from the board?
What would we be acting on today?
Just, we would take no action on the appeal and just close it because we've come to a out
Okay,
of.
So essentially, it's back where there's some things, big things have been fixed, smaller things need to be done for the bistro. The restaurant is pretty much ready to go. It sounds like, we had this agreement, we'll have ongoing training and, kind of really a chance to kind of just be better in the long run.
Correct.
So there's nothing we gotta do.
I don't
I
believe
just
so.
want to make sure, 'cause I mean,
All,
we're all here.
what we would need to do is to formally vote to adjourn. basically.
Yeah, well, just one more, yeah, go ahead, sir.
I just got one question. What do we do? How does the inspections for this place work?
So the inspections are twofold. So their consultant will also be doing in-house inspections, which they're going to be documenting. And then we will be doing our inspections as the Board of Health like we normally do. So what we would do is we would be confirming the trainings that were being done and the corrections that had been done to make sure everything is still in compliance as moving forward as normal.
So what was on for, just if I could try and make it a little bit of help. What was on for today, correct me, Attorney Riley, if I'm wrong, what was on for today was that we got a notice of non-renewal for the two licenses, for the bistro and for the Summer House Restaurant. As a result of that non-renewal notice, we were entitled to a hearing, which we requested.
Mm.
And this is where we're at now. We have now resolved the issues that are before this board for the hearing. So the Department of Health, for lack of a better expression, is closing out their request for the non-renewal on both licenses. And we therefore have no need to appeal. So the need for the hearing is no longer. And correct me if I'm mistaken about the way I put that.
Brian?
That sounds correct to me.
Thank you, Attorney Riley.
It sounds correct to me. So everyone
Thank you,
is,
Chair.
the best thing about this is you sat down, you worked it out without all this emotion and legal hassle. Okay,
At least publicly.
I congratulate both parties in finding a resolution to this.
Thank you.
So,
Can I ask a general question?
You can
that
ask
I
anything.
don't, as sort of a newbie, I don't know the answer to this. When a restaurant has had problems and that need to be corrected and adjusted and whatever, do they get more frequently inspected than somebody that passes with flying colors?
So the Massachusetts State Food Code and through their updates, they've changed this a little bit, but they do set a standard of low risk, medium risk, and high risk establishments. They do set a recommendation of inspection frequency for all three. Low risk establishment would be something like a retail store. If Cumberland Farms didn't make food, it would be something like that, you know. And then medium is where the great majority of restaurants stand, and then high risk establishments as well. When you do find what they call major violations in the food code, you do automatically enter the higher risk. So you do get inspected more frequently.
So that would be the case here?
In general,
Hard to say. I think that's what this hearing was about.
My
Exactly.
question is, you can inspect at will.
correct. Yes, the food code allows us to inspect at any time that the restaurant is open.
Okay, thank you all. So we need a motion then to close the hearing.
Make a motion to close the hearing.
Let us not close the hearing. Let's have one comment. Actually, I apologize. I was going to ask for public comments before we close it.
Chairman and the board, Stephen Cohen, I represent the new South Sconset Neighborhood Association, which currently has 24 households as members, probably growing. And I would like to thank the staff and the board and the other departments involved, including the applicant, for what I think went from a serious public health concern to a highly successful resolution, which we don't often see happening this quickly. So I think this is a great success story. But I do have two questions through you to the staff. One is whether or not there are pre-existing non-conforming conditions that are being allowed to continue. And the second one is, as a member of the public, not me, but in general, if someone wanted to find out updates about what's happening, is there a planned future event, or is there some kind of public update that would happen so that people can understand what's happening now and what's happening, maybe at the end of the season?
Correct. So quick clarification. We can also inspect any food establishment that is currently permitted and under construction, which is what the June 26th inspection was, June 23rd inspection was about. For the pre-existing non-conforming, there is no non-conforming compliance in the food code, but that is all we have jurisdiction over in restaurants, just strictly the food code. So in this situation, nothing is pre-existing non-conforming. It is being brought into full compliance with the today's active code.
But that may not apply to like plumbing or wiring or whatever.
Correct. That is the jurisdiction of the building commissioner. And then as far as if you're a member of the public, all inspections are public record. We do post all inspections on Laserfiche, which is the town's archiving system. And it is also available through Energov, which is our town inspection software. Anyone who is seeking information, feel free to email us at health@nantucket-ma.gov. You can email us and we can provide any of the inspection reports. They are all public record for any restaurant, any permitted or even non-permitted restaurant anymore. So for example, the Gray Lady closed how long ago when Island Kitchen expanded? We still have all the records of the Gray Lady.
So again, I think this is a great result. The one request I would have for the board before you close the hearing is to impose a condition for a public checkup at a meeting of the Board of Health at some time, in the September, October, and sometime in the fall after a few months has gone by, so that it would be more publicly available for people to find out what happened and to participate in a way that hopefully will also be successful. Thank you.
I think that's a good idea. We can put it on a September, October agenda, just to kind of,
I have one.
yeah, go ahead.
Supposing there is a problem,
Mhm.
how is the health department going to handle that?
We respond according to the food code.
I mean, okay, and if it continues, do we have the right to close again?
Always.
Okay.
You're reserving your right to still enforce the food code as it stands.
Thank you.
Thank you. Any other comments from the public? Okay, so we can just kind of have an update in September, October.
On the September meeting,
Yeah, well, September meeting.
September 21st, we can put it on the agenda.
Yeah, put on the agenda, just kind of how we,
We'll follow up.
how we doing.
Sounds good.
Okay, so now I need a motion to close the hearing.
Motion to adjourn the hearing.
Second.
Any discussion? All in favor?
Aye.
It is closed and we will hear again about how we're doing in September.
Thank you very much.
Thank you. Director's report.
All right, well, real quick, yesterday I discussed with the select board, the short-term rental regulation.
Could you just
But
please
why
keep
don't-
your, excuse
yeah.
me? Please be quiet where you're leaving.
Yeah, if there's going to be discussion, can you please do it outside? And we'll wait a few seconds. Okay, yesterday we did have a discussion with the select board about the short-term rental regulation. As many of you know, it's been delayed significantly due to the software not being up and running yet. We did finally get an update from Granicus, the vendor, yesterday around 3 p.m. and the select board meeting was at 5:30. We finally heard back that we are, in their words, 5/6 of the way through. We have 16% of the way to go. And that 16% is the training for the mobile permitting through the staff, which is happening next Wednesday, the 26th. And then they expect to go live the same week. I will not hold my breath, judging by what we've already seen. There are definitely some discussions with finance department about our vendor and where we are going with this vendor, and possibly changing vendors if needed. We are also hearing, we are also hosting and entertaining another vendor in case we need to move vendors in a quick turnaround. So that was short-term rentals. The nursing program is still moving forward. We actually discussed with the Cottage Hospital, they are bringing in Cape Cod Community College in congruence with the Nantucket Community School to do LPN courses here, which is kind of a big change. We've never had that here to start training medical assistants to become LPNs, and then they will also be sponsoring LPN to BSN, to LPN to RN, and then RN to BSN training. So to start creating our own internal Nantucket pipeline of nurses to address the nursing shortage. They have not Dr. Lee, Amy Lee, the CEO, and I discussed about, piggybacking it with the town possibly piggybacking that program, and they seem open to it too. Tick-borne illnesses, actually, surprisingly, we are as hot as this year has been. It seems as if the heavy freeze that we had in February may have helped kill off some of the tick larvae that we were expecting. We are having a proud 30% decrease from where we were at this time last year. Not saying that by December, the numbers wouldn't be equivalent or higher. It all depends on, we just had some heavy rainfall, which also spurs tick-borne life cycle, which helps the life cycle along. So that is something that remains to be seen come this fall. However, the good news is Babesia and Lyme are both down. Anaplasma has stayed at around the same rate this year. And then in congruence with our public information officer, last week or 2 weeks ago now, we started pushing out a sunscreen campaign because we are getting into a much hotter summer, with climate change, it's become a little bit stronger. And as some of you know, Nantucket is actually the highest melanoma rate in the state of Massachusetts and one of the highest in the country. So we're getting back into preventative public health, which is something we haven't done in 3.5 years. So we're very proud to say we're moving forward with that. And then with lastly, I know they weren't expecting this, but we have 2 interns this summer. Marianne, stand up, please. Marianne Vasquez Cruz, who wrote the policy brief on our well regulation, who's at UMass. And then we also have Olivia McAleese from Queen's University in Belfast. They have been a tremendous addition to the staff here. So we just wanted to commend them and say thank you for being here today. Yes. Thank you for huge amounts of work. So it's been a really good summer so far. 1 or 2 meetings aside. And with that, I'll call it a day.
Okay. Any questions, Mr. Barnes?
I'm just sort of getting caught up, of course, in this STR thing. But here's a question. As far as I know right now, we're talking about 9 rentals in July and August. Is that correct?
Correct. I think
Right.
that's what the short-term rental work
Okay.
group came up with.
Here's a funny thing. My family uses my cottage for 2 weeks. Do I have to count them as a turn, or do I just count the ones where I pay the state tax?
That's a good question for the
I think
short-term
it's
rental
one we
work
should
group.
pay attention to as we're looking at it, because a lot of families, will come down and use it. And so it might be something we keep in mind as we tune up on the regs.
Sounds good.
Thank
It's
you.
a-
Is your family paying you for? I
That's a
mean,
good
there-
point.
A rental would.
Do you
be a
think my family
contract.
is going to pay me to stay in my
But-
cottage?
So when you say a rental,
No,
it's
use.
not really
I'm-
a rental. if
Well, it
you're-
isn't. No, that's the point. Are you counting the use by family for a week as a rental? I submit you should not. We're only, if I
Yeah.
pay the state tax, I collect 11.7% and pay that money, that counts. So
Correct.
out of 9 weeks, I'm going to have 7 of them. But 2 weeks, my family is going to be there like this coming week.
Curtis,
I mean.
Curtis, it's only a rental if you call it a rental.
I don't call it a rental because they stick it right to me and it costs me a lot of money to have them there.
Well, I think there's a lot of questions that have to be answered about how we enforce and just enforcement issues. And I've mentioned a couple of times, I have great fear that this wonderful staff is going to perhaps be overwhelmed with lots of questions and work.
In
But I've been told
as with-
that we will adequately support it.
I
Okay.
have-
Can I
I-
give everybody one quick question? Mental health stuff, anything going on, related to mental health and, like I know there's been a lot of bubbling in the background and stuff, so.
Should really always bring Jericho to these. So through Jericho, through the Human Services Department, he has been very active in the behavioral health initiative. There has been some training in QPR, of course, the question, persuade, refer, but also our public health nurse, we went to a all-day training on Tuesday. Not went to, it was online, but an all-day training on mental health and suicide prevention. And then we also have funding to be able to send a couple staff members to the mental health first aid training, train the trainer. So that way we'd be able to host our own and start providing that training here for anyone who needs it. So it is moving along. It's not as fast as we would like. It always feels a little bit like crisis response. And we would like to get into proactive response of mental health here. And we do recognize that we are headed to a very difficult season. So we're trying to get ahead of it.
Thank you.
I know Meredith.
Is there a time in the next couple of months you could have Jericho come in and
Yeah, I can have him come to the next meeting.
kind of maybe in August? I think
Mhm.
we pushed 2 things in September and
Yeah.
August.
I'll have Jericho come to the next meeting.
Just 20 minutes, half an hour of
Yeah.
what we're doing.
And Jericho, I know you're watching on YouTube, so you know, I just volunteered you for August.
Well,
He'll be here.
whatever, soon. Because
I have some questions.
go right ahead.
One about the Granicus. I just think like we're heading into year 2. Like what I just don't understand how they can't seem to get it together. But also, I think, well, I'm not in support of the article that is coming forward and maybe won't go to town meeting. I don't know. Because I do think that it's putting a lot on a department that is not huge. And I think that I don't know how to go about this, that the town really should have its own department for STRs, and that could be within the health department, but be its own office, so that people have somewhere to go to ask questions, where we can have a robust system for people registering, for if there's issues, a place to call, a place to respond. I know that there have been calls to the fire department from STRs because people aren't able to get a hold of the people that own the STRs. And so that because they're corporate, and that was super concerning to me. I think the RM program is amazing. I did not know that about melanoma, but I wonder if we could start doing see if we could have dermatologists speak or doing some kind of outreach.
Oh, that's a great idea.
I know Dr. Qureshi is
Mhm.
here, and he's a great resource. And the last is, there is a really giant grant for substance abuse prevention in children or kids for, I think, under 25, for about $1 million. And I know when I found out about it in May, I was told by multiple people that there wasn't enough time and that we would apply for it for the next grant cycle. And I'm just not sure who goes about getting that group of people together to get that grant, because it's a lot of money for a rural community. That's who it's for, rural communities. And if we couldn't do it in May, and I understand, I don't know how to write grants, but okay, it's July, let's get a team together to work on that and figure out how to get that money, because it's a lot of money. And I think going into the next year, it would be really helpful to the community. We could provide a lot of services with $1 million.
Absolutely, we can definitely be the spearhead for that. We can be the head.
Prevention, Meredith, or treatment?
It's for prevention.
Prevention.
And it's $1 million a year for 4 years, I think. It's a pretty, but I think it's very involved putting it together.
State or federal?
Federal.
Federal.
It's through HRSA. For some reason, I'm
And
forgetting the acronym right now.
Be amazing to get, but I don't want it to be May again and say, here, it's due in 3 weeks. Let's put this together, and be told again, we don't have the manpower to do it. So it wasn't this department, it wasn't the health department. I spoke to multiple agencies on the island because I got it through an email as a school nurse, and it's, I think, an amazing opportunity. And that's fine that it takes a long time, but I think if it takes a long time, let's start getting people together to start thinking about it with all of the mental health issues that we have already.
Yep, no, absolutely. We can definitely be the spearhead to that. We can be the head on that and start taking that by the horns. To answer your question, it is kind of the revamp of the old drug-free communities grant. If you remember that one from the White House back in, what was it, 2008, I think, 2009, when they first came out. There's a new infusion of funds into that same program. It's just administered in smaller grant cycles this time.
And it seems like behavioral health initiative thing we're trying to go was to help lay the groundwork for having a structure to really use as for applying for those funds. You know, to start pulling together the teams, the collaboration, and also get some pilot kind of things going, get some, try different programs and also assemble the programs that are already happening on the island, but kind of make it so there's a cohesive, like, yeah, we do know what we're doing and we are working together. And here's a bigger structure that would be done through that behavioral health initiative. And that would like to be the groundwork so we could actually apply in a sane kind of well thought out way for the next round of money. So that's what the hope is.
So what are we doing?
It'll be us who write it. It'll probably be the health department who writes it. We should be done by May. Yeah. Yeah, absolutely.
There's a lot of organizations that I think.
Yeah, you need to create a small coalition. Before it used to go to one group. The original, actually, we did have the drug-free communities grant here once. ASAP had it. It was the primary funding source for the Alliance for Substance Abuse Prevention. Once that funding dried up, ASAP was actually absorbed into NAMI, the National Association of Mental Illness. So it's a very similar grant.
All right. Ladies and gentlemen, anything else? Only an hour and 10 minutes. That wasn't bad.
Yeah.
Motion to adjourn.
Second the motion.
All in favor?
Aye.
Aye.
We are adjourned.
Thanks. I thought it was gonna be all the way through dinner. Remember
I
we
had a whole coffee. It's ready.